Good morning. It is AM Tampa Bay with Jack and Ted here at 8:40 on a Monday morning. And we have a very special guest joining us right now who's had quite an impact in Teddy's life and in a lot of other people around the Tampa Bay area. And Teddy, why don't you talk about your experience?
Yeah, I had problems with my right knee. I mean, I couldn't even sleep at night, Jack. I'd lay down sideways. I'd have to put like a pillow in between my knees, and my knees would throb, and it would wake me up a lot of times. And I ran into Ian Beckles in the hallway one day, and Ian saw me limping a little bit, and he said, why don't you get stem cell therapy? And I said, I'm not too familiar with it. I mean, I've heard about it being used for treating other things, but I didn't know it could be used to treat your knee. And he turned me on to Dr. Dennis Locks in Clearwater. And Dr. Locks changed my life. Dr. Locks, I got to ask you this, man. What is the secret to stem cell therapy? Why does it work so well?
Well, that's an interesting question. Your body wants to basically repair itself, but it just can't. We don't have stem cells in our joints, and therefore we can't repair ourselves. So if we were to think of ourselves in a different model, like a lizard regrowing our tail, regenerative medicine actually has that capacity. If we just bypass the limitations of Mother Nature, we can help to repair ourselves without surgery, without doing some of the more drastic things. And it's just simply a method of using modern science to help heal ourselves.
That was what was appealing to me, was the fact that I could be healed without surgery, because everybody else that you talk to wants to do a knee replacement. They want to do this, they want to do that. And I wasn't all about that. Being a diabetic, I didn't want anybody cutting on my lower limbs. And I was impressed at how simple the procedure was. I mean, I didn't lose any downtime, Jack. I left here that day, went with Eric to Dr. Locks' office, had the procedure done, and I was back at work the next day. I didn't miss any time off at work, which is impressive.
Yeah, we have actually a lot of patients that fly from overseas, and they're on a plane the next day. I've had some people fly the same day. I had it done 4 years ago to both of my knees, and did it on the Saturday at a medical convention, and was on a plane the next day and back at work Monday. There's no downtime.
Explain how the procedure works.
Well, do you want my...
We're changing
let's change the microphone, because that microphone's
well.
breaking up there. There you go.
You want all my secret bag of tricks? Is that what you're asking for?
No.
Because I can't do that.
No, I know. If you could just tell people how the procedure works, so
ease
their minds. Because
yes,
you talk about stem cell therapy, they're in the dark too. They don't know how this stuff works.
Well, it's basically pretty simple. There are repair cells called stem cells in our body, and if you know scientifically where they're at and how to get them, each patient is different, so you make an individual decision on what's best for that particular patient, and then you make a game plan of the best way to get them. And in adults, there are generally two main sources, bone marrow or fat, and you just select what's best for each patient, and then it's a very simple local anesthetic technique. You're not asleep, you're not awake, it's not painful, and we communicate the whole time. We have conversation, and someone like yourself, you're a little bit dry, so I had to carry the conversation, but it worked.
That is miraculous. I know he had it done on his knee, and you had it done on your knees, I think. Can it work anywhere else?
Yeah, I've had probably just about everything. I had last week we had a 2-year follow-up on a 14-year-old wrestler who had a dead bone in his hip. The same thing that happened to Bo Jackson. It's called avascular necrosis, and he's now 16. He's graduating from high school, and he's in remarkable physical shape. And I didn't go back to wrestling because of the impact, but he's done well. I've had another 14-year-old that had a dead bone in her foot, and they were going to fuse her, and her soccer career was going to be over. And now she has scholarship for a college to play soccer. So it's really rewarding to see him down the road.
Talking to Derek Brooks, he said you worked on his wrist, right?
That is correct.
That is excellent.
So it worked there, too, the stem cell thing.
Yeah, I had a concert pianist from London fly in, and they can't do stem cells in London or England or Canada. Their healthcare system is slightly different, so I actually get a lot of people that come across the pond. But she was a concert pianist and I had a bad wrist, and we did her, and she was playing in a.
Why can't they do it in England and
regulations?
In Canada? You know, the funny thing is, and I've told this story before again and again, with some people that was on a cruise ship, and there were 3 ladies from Canada. We were talking and about, they were saying how great their healthcare thing is because they don't pay anything. You know, I mean, it's basically taken care of by the government and all of that. And I was saying, well, we're about to get something similar with Obamacare and everything, blah, blah, blah. They said, oh, no, don't do that. Because whenever they had any kind of real serious health issues, they come down here to the United States to get it done because their medical care up there is lousy. They don't pay for it, but they don't pay for lousy health care.
It's quite interesting because they'll wait like 9 months for an MRI, or if they are told by their orthopedic surgeon that they need a knee or a hip replacement, they get put in line, and it may be a year. So the wealthy ones who just want to bypass that, they
go to the United States.
They come here and they see me, and then they get all fixed up. And
let's say I hurt my knee again. Let's say that I'm playing around with my grandkids or something, and I hurt my knee again. Could you do stem cell therapy again on that knee that you did it on the first time?
Absolutely, yeah. In theory, you can re-injure anything, and my biggest task is if I have an easy patient that I think is going to do really well. Humans are not like laboratory animals. They're very diverse. They do all kinds of things. They eat different things, and they do different sports activities. So we get a lot of people who are triathletes and Ironman, and so we face challenges in what they do after we do it.
Dr. Laux, before we run out of time here, first of all, I want to get information where people can get in touch with you, but good point brought up by Jeff here. Does insurance cover this?
No, it does not. In the United States, it's considered elective, like plastic surgery.
Oh, that's crazy.
Well,
that's crazy when you take
somebody
away
as
pain
good looking as you
like
doesn't need plastic surgery, so it's not a problem.
Oh, man. Well, where can people get more information and get in touch with you?
Well, my office is in Clearwater, and I also have an office in Beverly Hills, California. But my main number is 727-462-5582, or you can simply go on drlaux.com.
drlaux.com.
It's L-O-X, drlaux.com. And again, that's L-O-X, easy to remember. And Dr. Laux, thank you for coming by this morning.
And thank you for turning my life around. I appreciate that.
Yeah, this is very interesting stuff here. We appreciate it.